Dr. Cosgrove, at his time at the Cleveland Clinic, has always been a champion for virtual care.
I want to put out there how excited I think people at this and across healthcare ought to be about the potential of distance health, virtual visits, embracing the new technology, but it will be a much slower process than it should be. And it's going to take people like the people in this audience who are going to be leaders in the field to go back to their home turf and be disciples for making that happen. And I think it's an enormous opportunity for patients, for the country, and for you all as leaders to move to the front of this sort of opportunity.
Teleneonatology for us really focuses primarily on assisting our colleagues in the community when they have a high-risk resuscitation. And so we've been very fortunate to be able to work with the InTouch team to kind of talk about how can their amazing devices be somewhat even improved or modified for this use case. We monitor a couple of our reliability metrics, one of which is the ability to connect on the first attempt. And you can see with our wired cart, we were only hitting that 3 out of 4 cases, so that meant other cases multiple times we had to attempt to connect. And with InTouch, for this data set, we were hitting at least 95% of the cases.
We'll probably do about 35,000 encounters this year, give or take maybe 1,000 or so, but that's kind of where we're on target now as we just passed the halfway mark of the year. And we continue to grow at a clip of about 30 to 40% year over year. So the number of escalations and SEV1, SEV2 issues that came up dropped off precipitously. And we were fully on the InTouch platform on December 18th. The reliability that we've had with InTouch and the fact that they're being very aggressive moving out of the acute space into other areas as well, and very excited to look at partnering in those ways as well.
This partnership today is bringing together a company in InTouch that knows a lot about their respective marketplace with a company that's been in healthcare for over 50 years. And in that time, we've seen a lot. So that know a lot and that see a lot comes to your advantage in one partnership that can help you accelerate your change agenda. We believe that together we're a multiplier to help you accelerate your agenda.
So we're going to open up the key architecture of our system, and we're going to open up how it works, and we're going to work with NTT Data to link it into your revenue cycle management and link it into all of your key applications. Because let me tell you, if this CMS rule goes through and all of a sudden everyone is going to be paid for virtual visits, having this as some separate system is going to be not as advantageous as having it embedded into your everyday practice is. And ultimately what that delivers is the operating system that we're creating helps become a part of your entire ecosystem as you virtualize care, because there will be a day in the very near future where virtual care will be healthcare.
Today we are, on average every year, we're providing about 15,000 telehealth consultations through 18 different clinical programs and in 26 different locations. The goal of our partnership is absolutely simple. We want to be able to work together and think that by coming together, we will be able to continually increase the uptick and the utilization of virtual care.
The InTouch coordinator. So what does it do? It notifies the provider from that device. So you don't need to scroll through your whole list of devices. The patient's checked in on that device, it notifies the provider, and the response of the provider is to that device. Simplifies the workflow.
And in the acute space, failure of the technology in this space is not acceptable. And so we had to look for different alternate technology or else we just could not grow. And so it's okay when it's half a consult a month, but when you're doing 50 to 100 consults a day, you need high fidelity and reliability of that technology. And again, as you all know, InTouch is really that partner for us where we can always rely on that technology to work and then having that redundancy.
Direct-to-consumer should be thought of differently than legacy telehealth. We're in the wrong wheelhouse if you're worried about insurers not paying for your direct-to-consumer strategy. If you're waiting for that, you are teeing yourself up. Literally, let's go play golf. You're putting yourself on that tee to be knocked 300 yards by a disruptor. If that's what you're waiting for, I would suggest you're already too late.
As you know, Rite Aid is one of the nation's leading drugstore chains, and we've long believed in telehealth as an opportunity to improve patient care. Our scale and our virtual care technology will help provide continued patient engagement, and not only help to address access issues, but also improve patient care coordination and ultimately reduce the cost for all stakeholders involved.
Leveraging the InTouch operating system, we'll be able to extend the same reliability and scalability you've had to get quickly into a location now into retail pharmacies and other locations such as community and employer sites.
We rolled out virtual visits, working on self-scheduling. The virtual visit campaign has seen over virtual visits, not distance health in totality, just virtual visits, about 45,000 patients over the last couple of years. And very interestingly, patient satisfaction is statistically significantly higher with virtual visits as well as shared medical appointments when you compare it to new and established regular appointments.
World Telehealth Initiative has an unprecedented capability to provide telehealth throughout the world. And our very first program was in Malawi, one of the reasons being their doctor-patient ratio is 1 doctor for every 55,500 people. Dr. Jeff happens to be in Malawi right now, and we are beaming into him so he can share his experience with WTI.
The InTouch virtual care devices are rapidly becoming an integral part of that care. We've had a lot of initial success implementing the virtual care device here in the Fistula Center, and have plans to expand it to our new maternity unit. I can assure you our bandwidth here is very low. So they've managed to figure out the bandwidth issue like no other entity has.
It was recently published that a doctor spends for 1 hour of FaceTime with the patient, they spend 2 hours on documentation. And I actually think that telehealth and virtual care delivery creates an underlying infrastructure by which we can solve this terrible problem of over-documentation. I think that if we build a system which puts a virtual layer on top of the brick and mortar system, we can improve the ease of use for our patients, we can reduce the burnout from our physicians and clinicians, we can improve quality of care consistently across all geographies, we can reduce cost, and we can do this to the great benefit of our overall society.